Hello everyone. Welcome to the fourth episode of our Facebook Live session, Let's Talk Health. Today we have a very special guest, Dr. Sudhir Kogandi. He is an experienced and a renowned interventional cardiologist consultant in India. Today he will be sharing his knowledge with us about PCI, which is percutaneous coronary intervention. PCI is a life-saving treatment procedure for patients with heart disease. Let's dive into the world of cardiology together. Dr. Sudhir, welcome to the session. We are glad to have you.
Thank you very much, Preeti. And, thank you very much for having me here.
So before we start, I would request you to share a bit about your experience and expertise in your background.
Yeah, sure. Thank you for asking that. My MBBS was from Armed Forces Medical College in Pune. Everyone knows how famous or reputed institute AFMC is. It's run by the Ministry of Defense. And following graduation, I moved to the UK, where I did my subspecialty and super specialty programs, particularly cardiology as well. My interventional cardiology experience was all at a renowned hospital called Bart's Heart Centre, based out in London. Along with that, I spent some time at Erasmus MC in Rotterdam, Netherlands, as well in honing my skills. Once I finished my training and the advanced fellowship in coronary intervention, then I moved to India in the year 2017, and I've been here at Citizens Hospital, for over half a decade now, doing the, providing the service, the cardiology services here.
Thank you so much for sharing with us. So what is percutaneous coronary intervention and what it is used for?
Okay. So percutaneous coronary intervention, or commonly called as PCI, or commonly called as angioplasty, is a process or a procedure in which you're doing a procedure to remove the blocks in the coronary arteries, to put it simply. So whenever there is anybody who's diagnosed with coronary artery disease, or in a layman's language, blocks in the heart arteries, it's usually built up because the block is built up because of cholesterol. You're doing this procedure to alleviate the symptoms to the patient. And what you essentially tend to do in PCI is you're going to break up this cholesterol-rich block with a balloon, and 99% of the times you're going to go ahead and put in a stent. So you essentially implant a stent which is made up of an alloy, either cobalt, chromium or steel, and also drug coated. Okay. So what this stent does, this stent removes the block and ensures there is good blood supply through this artery to the cardiac muscle, to the heart muscle. And that is going to help in preventing heart attacks and also alleviating the symptoms so that the patient can have a good quality of life.
That's great. So is surgery always necessary for patients with coronary artery disease, or it can be used as an alternative?
Okay. It is a misconception that patients have. That patients usually think only one treatment is better. It's not like that. These are all complementary. Not everybody is going to be suitable for stenting. Not everybody is going to be suitable for bypass. And in some patients, we may just have to leave them on tablets. So, like I said, it's a misconception that one treatment is, suits everybody, or one treatment is the best. So the best thing usually to do in this kind of situation is to involve something called a heart team. A heart team is a team which consists of a cardiologist, a surgeon, ideally an anesthetist, and also a cardiologist who doesn't do much intervention. Okay, it's best for all these brains to get together, discuss the case, not just the angiogram, discuss about the patient, his age, his comorbidities, and then come up with the best decision which is going to serve that particular person better in the long term.
We would also like to know more about a complex PCI procedure. How is it performed?
Okay, great. PCI is of various types. Like I said earlier, you can just do ballooning and leave it. You can put a stent, and sometimes you may use something other than stenting to give a better results of stenting. No, let's start this again. Yeah, PCI is of various types. Like I mentioned earlier, sometimes you can just get away by doing a drug-coated balloon, or usually you go ahead and put in a stent. And sometimes you may use adjunct tools to ensure you got a really good stenting result. By tools, I mean using things such as intravascular ultrasound, commonly called as IVUS, or optical coherence tomography called OCT. These tools will ensure or reassure us that we got a really good stenting result, because that's what's going to give the patient a really good long-term result. Sometimes we may even use something called as invasive physiology, where we use a wire called as an FFR, or a technique called as an FFR with a wire called pressure wire, or IFR, to determine whether a person needs stenting or not. Okay, and we can do all these, use all these modalities, all these techniques and technologies at Citizens Hospital. Now, precisely about complex PCI. Complex PCI, you define complex PCI based on various things. One is the anatomical suitability of the blockage, the lesion, and the patient himself. For example, if somebody has got a really critical blocks, which has got a lot of calcium, and they're at various places involving the branching of the arteries, wherein you may have to do overlapping stents and things like that, or you're dealing with the main arteries on the left side called left main stem, and you dealing with these kind of anatomical substrate in a patient who's older, or who's got a lot of other diseases such as badly controlled diabetes, hypertension, or if they got other issues such as valvular problems, or most importantly, if they have a reduced ejection fraction. By that I mean their main pumping chamber of the heart is not pumping properly. All these things are going to increase the risk of the procedure. By that I mean when you're doing a stenting procedure in this kind of situation, the procedural risk is going to be slightly higher than what we would call as a simple angioplasty.
So our complex PCI procedure is available in every cardiac center, or is it limited to the specialized facilities?
Yeah, that's a great question. Actually, it's not available in every center. These days, there are cath labs everywhere, in small hospitals, in big hospitals, everywhere it's called cath labs. But these kind of complex PCI is only available in tertiary care cardiac centers. For this, you need a lot of technology, equipment, the machines which I've mentioned earlier. You need the expertise. You need a big team of cardiologists, cardiac surgeons. You need cardiac surgeons backup as well, in case if there's a complication, you need their help. And also you need a good intensive care unit where these patients are going to be looked after the procedure. And when it comes to equipment, when it comes to things such as IVUS machine, the OCT machine, or when you're doing complex PCI, you're going to use calcium modification tools such as rotablation, intravascular lithotripsy, and sometimes you may even use devices to support the poorly pumping heart with the devices such as Impella or even ECMO. And these are not available in each and every cardiac center. They are concentrated to a few tertiary care cardiac centers in cities such as Hyderabad.
Right. So what is the typical recovery period after a PCI procedure, a complex PCI?
Yeah, it depends. I mean, usually with straightforward PCI procedure, the recovery is a day. I don't usually keep patients no longer than a night in the hospital after a straightforward PCI. With complex PCI, it actually depends upon the patient's recovery. If the procedure went smoothly and there are no hiccups afterwards, and the creatinine, the renal function, and the blood pressure are all stable, they may not need to stay for more than 2 to 3 days in hospital. However, there is another substrate in which we do complex PCI, which I did not cover earlier, is something called cardiogenic shock. Sometimes people come to hospital with a massive heart attack with pretty much low to no kind of blood pressure. Those are the situations you're going to support them. Along with the PCI, you're going to support their heart to recover with the tools such as Impella or ECMO. In those cases, the recovery can be slightly longer.
Are there any complications of a complex PCI procedure?
Any procedure carries complications, right? The complications associated with the complex PCI is probably a little higher than the simple PCI. For any simple PCI, what we tend to quote in terms of complications based on the international data is a risk of 1%. Okay, there's a small chance that somebody may have a heart attack or any serious complication at the time of the procedure. With the complex PCI, the risk becomes slightly higher, but it's difficult to put a number to it because you have to take various factors into consideration. But the important thing is, what do you do when these complications arise? You should be able to deal with it, which we are confident at Citizens Hospital. If we are happy to offer complex PCI, and if something goes wrong, we are confident of dealing with this complication and ensure the patient is going to recover well.
Yeah. So before we close this session, there is this last question that I would ask. According to your experience, what is the success rate for patients who undergo with this complex PCI?
I mean, if you choose the patient correctly, and if you use the technology correctly, and ensure their recovery is smooth, the success is pretty high. But you have to take it in the context, like I said earlier, based on the patient-to-patient basis. For example, if somebody comes with cardiogenic shock, wherein I mean somebody had a big heart attack and the heart is not pumping that well at all, in them, the mortality, even if you don't do anything, is very high. Even in the best of the hands is 50 to 60% chance of survival. But on top of it, if you could offer them the best treatment that is possible by doing a timely coronary intervention, PCI, along with support such as Impella or ECMO, then the recovery is going to be very high. And again, the important thing is it's not just about offering this technology. It's about offering it to the right person. So, for example, if you put somebody on ECMO in somebody who's older and whose presentation is a little late, the benefit is not going to be much. Okay, it's almost futile. But on the other hand, if you offer to somebody younger who comes slightly earlier, then the recovery is going to be very, very good. I'll share an example with you. Recently, we had a gentleman who came into our emergency department and then had a cardiac arrest because of a heart attack. He was 35-year-old. The determinants of successful recovery in these kind of patients are effective CPR, timely PCI, the stenting procedure, and then support afterwards. So in this gentleman, we did not stop CPR for almost 1 hour. So we carried on for doing CPR for 1 hour uninterrupted. At the end of 1 hour, there was pulse and he was alert. So meaning his cardiac heart has recovered so that we can offer something much more advanced. And also he's alert, meaning there was no significant brain damage because of the long-standing CPR. After that, we did a timely intervention. He had stents to 2 of the main arteries, and then immediately we put him on ECMO because he was in severe refractory cardiogenic shock with a blood pressure that is unrecordable and a cardiac function which is barely 10%, 15%. But with ECMO, he recovered really well. Within 5 days, we were able to get him off ECMO, and within 10 days, he went home.
Thank you so much for your valuable insights on PCI, and we are glad to have you here. We really appreciate your time and your dedication to helping patients with heart disease. Thank you again for joining us today.
You're welcome, and it's my pleasure. And I would just like to point to the audience. We're regularly putting out content into social media in terms of Facebook, Instagram, even my YouTube channel, which has got a wealth of knowledge, and feel free to just go through those and clarify your doubts.
Thank you, sir. Thank you for tuning in to our Facebook Live session, Let's Talk Health with Dr. Sudhir Koganti. We hope you found today's discussion informative and engaging. If you have any comments or questions, leave them in the comment box below. Don't forget to mark your calendar for next Friday at 4 p.m. when we will be coming with another exciting topic. Till then, stay healthy and stay informed.